Let's see the arterial supply of upper limb. The subclavian artery is divided into three parts by scalenus anterior muscle. The first part gives rise to three branches: internal thoracic artery, vertebral artery, and thyrocervical trunk. Thyrocervical trunk gives off three branches: suprascapular artery, inferior thyroid artery, and transverse cervical artery. Second part gives rise to costocervical trunk, which splits into superior intercostal and deep cervical artery. The third part gives rise to dorsal scapular artery. The subclavian artery continues as axillary artery, from the outer border of the first rib. It is divided into three parts by pectoralis minor muscle. The first part gives rise to one branch called superior thoracic artery. The second part gives rise to two branches: thoracoacromion artery, and lateral thoracic artery. Thoracoacromion artery splits into four branches: pectoral, acromial, clavicular, and deltoid. The third part of axillary artery gives rise to three branches: subscapular artery, posterior humeral circumflex artery, and anterior humeral circumflex artery. The axillary artery continues as brachial artery from the lower border of teres major muscle. The brachial artery terminates into radial and ulnar arteries. It gives rise to profunda brachii artery, superior and inferior ulnar collateral arteries. The radial artery gives rise to radial recurrent artery and superficial palmar branch. The ulnar artery gives rise to anterior and posterior ulnar recurrent arteries, common interosseous artery which gives rise to the anterior, posterior, and recurrent interosseous arteries. The ulnar artery at the wrist divides into superficial and deep branch. The superficial branch forms the superficial palmar arch, which gives rise to four common digital palmar arteries, which in turn gives rise to proper palmar digital arteries. The radial artery continues as deep palmar arch, and anastomoses with deep branch of ulnar artery. The deep palmar arch gives rise to princeps pollicis artery and radialis indicis artery.